you really should be challenging your doctors. And oftentimes patients don't know what questions to ask. And so they just say, well, this doctor knows way more than me. Why am I going to question his authority? If he's telling me to do this treatment plan, I should probably just follow this treatment plan.
Right.
But we actually probably should be getting second opinions. We should be using our primary care doctors as our sounding board. And so that's where we also can help.
Let's do it. All right, everybody, welcome to Running Free. I've got an awesome guest here. We have Chloe Harrouche. Welcome, Chloe. How are you?
I'm great. Excited to be here.
A fellow Northeasterner. That's a word, right? Northeasterner.
You know what? We can make it a word.
We can make it work. But you're a New Yorker.
I'm a New Yorker.
You're a New
Manhattan.
Manhattan.
Not just New York, Manhattan.
Right. And I don't hear any of like my father. My father used to talk like this, like, oh, what are you doing? Hey. I don't hear any of that in you. You sound like me, honestly.
Yeah, I think I have a pretty good accent.
Yeah. Well, New Jersey, New York. It's nice to meet you face to face. We've chatted on the phone. Chloe is the founder of the Lanby, which is one of the best concierge medicine practices, groups, companies out there. We'll get into exactly what that means. I'm really excited to have this conversation because, as you know, Chloe, I work as a chief operating officer in healthcare. And I say that to say, I've seen some problems in our healthcare system, whether it's the way that it's structured, the fee-for-service model, the profitability of it. I work in nonprofit now, which is so much better than my previous career. But another reason why I'm excited to have this conversation is because what you're trying to do is to get medicine, to get healthcare to focus on the whole person and to prevent problems from happening, not just get to the point when we have to treat them already. And I know you have a story to share around that, and we're going to get into that. So I'm really stoked to have this conversation with you. But if we could start with two very maybe like high-level questions, and then we'll go deep. But what is the Lanby, and why did you start it?
So, two great questions. What is the Lanby? So the Lanby is, as you described, a modern concierge practice. We sort of took a different spin on the traditional definition, which is really focused on 24/7 access, being able to text your doctor or call your doctor at 10 p.m. on a Saturday night. That's really what an older generation craves when they go concierge. What I felt our generation needed was more prevention, more holistic, more functional primary care. And so when we think about modernizing concierge medicine, it's sort of taking primary care and layering in all these other modalities to allow it to be a vessel for a more proactive approach to care. So that's the Lanby. We're a membership-based model. We sort of have a care team approach where patients get to work with a physician, a wellness advisor, a member advocate collaboratively to be able to really get at whatever is the root cause of their current issues, but also use that same investigative lens to identify personalized ways to optimize your health. In terms of why, so the why really started when I was 23. So I had always been in healthcare. I've always been obsessed with biology and medicine. But my career had really been focused on the healthcare side. Like I was a healthcare consultant. I worked really closely with providers and hospital systems and was enamored by it all. But when I was 23, I was diagnosed with breast cancer completely out of the blue. And for the majority of my care, I actually, still maintained the same level of appreciation for the healthcare system. I was seeing some of the best specialists. I had my oncologist, I had my surgeon, I had my radiation oncologist, and they were all top of their field at what they do. And I, had this mentality of like, I'm going to be the best patient. I want to do whatever it is that they tell me to do. I'm going to be as aggressive as they want me to be because I want them to ultimately sit with me as long as they possibly can. And I felt like the more they liked me, the more time they would spend with me. So like already I was going into the patient experience with this mindset of doctors don't have time. How do I somehow sneak my way into convincing them to spend more time with me? It's by making sure that I am a yes patient. Like, I don't want to be difficult. I don't want to have problems. I don't want to question their authority. I just want them to love being around me. And so
Yeah,
that
it's
when
like
they see me on their schedule, they're like, yes, Chloe's on my
right. It's almost like
schedule.
you thought by being like a great patient that you would get better care.
Exactly. Exactly. Well said. Thank you. You summed it all up really
Yeah.
perfectly.
No, I
Exactly.
never thought of that. I never thought you wanted them
Exactly.
to enjoy working with you and be proud of your participation and in so doing get better healthcare, which could be foreshadowing an issue. But go ahead. Sorry to interrupt you.
No, so that's exactly what mentality was. And so I just put my head down and did all of the things. I literally didn't question anything. Anytime I remember my mom, as a 23-year-old, my mom came to every appointment with me. And anytime she would question why they were doing something, I was like, stop. Like, you're gonna make them so annoyed at us. And we ended up getting into so many fights about it at the time, I remember. But anyway, so fast forward, I was done with treatment. And I remember sort of like the checkout process, which is like, okay, now you're going to be on tamoxifen, which is this drug that, breast cancer patients who have a hormone receptor positive type of breast cancer take for about 10 years. So that was like what I was going to be on for, the rest of, the next, or at least the next decade. But then that was it. And so I was like, wait a second, like, should I be changing my diet at all? Like, I was one of those people who was generally pretty healthy looking, but like I wasn't eating healthy by any means. Like, bagels and cream cheese were a big part of my diet, pizza, burgers, like I loved all of it. And so I was like, am I supposed to be changing my diet? Do I need to cut out anything? Do I need to be exercising more? I had been an athlete in high school, but literally did not step foot in the gym in college. I was like one of those people who gained a lot of weight in college because I drank so much. Like, I just wasn't at all your picture of health. And they were like, no, like, just, you're not overweight, so it should be fine.
Quickly, so when you say they were like, you're talking
My
about your
my
oncologist.
oncologist, I didn't have a primary care doctor.
Got it. Got it. And why do you, sorry, another quick question. Why do you think, because so many patients, breast cancer survivors included, but any cancer survivor probably walks away with that limited kind of follow through instructions and doesn't even question their lifestyle, their habits, their exercise. Why do you think that you even knew intuitively to ask that question? And then I'm assuming to be a little bit, upset with the lack of guidance. But like, why did you even know to ask that?
It's a good question. I think that because I was so young, I was like, I have so many years left. How do I take
Yeah.
back control and feel like I'm doing whatever I can to avoid this from happening again? Because
Yeah.
in my mind, I knew that if this does happen again, I'm pretty screwed. Like, it's,
Right.
more aggressive, probably metastatic. And at that point, this sort of standard of care, quote unquote, isn't going to work. And I'm going to have all these people take care of me again. Like, I really didn't want to be a patient. I didn't want to be a victim. I wanted to feel empowered. And it felt like the only way that I could do that was by, changing my lifestyle.
Right. Not take, hey, go take this medication for a decade and let us
And I
know.
was happy to take the medication, but I was like, that can't be all. Like, there has
Right.
to be more. Like, I know that alcohol can't be good for me. And
Yeah.
I know that there are other things that I should be doing. I know that there's this whole industry of wellness. Like, what is it? I didn't know
Mhm.
much about it, but I know it was there.
Right.
Um, and so when my oncologist was like, as long as you're not overweight, you're fine, or not you're fine, but there's nothing else you can do. I was like, that doesn't seem right. And
Yeah.
so this sort of, mindset of like, okay, maybe now is the right time to question my doctors, because maybe they
Mhm.
don't know everything. Maybe they
Right.
are missing a side of the equation. And so that's when I started to explore primary care, because I realized I needed more of a quarterback, like someone who understood my health history, right? Like, to the extent that my oncologist to me felt like they needed to be my primary care doctor, but actually they couldn't because they didn't understand any other side of my health. So I needed someone who could understand that I had been through this, cancer experience, and now needed to think about my health more proactively. So primary care felt like, okay, the most generalist resource that I could find. And I don't know about you, but like, any primary care doctor that I saw, it did not matter how much I spent, right? Like, I went to the concierge, I went to the in network. They all had the exact same answer, which is like, you seem healthy. I was
Mm.
like, I am currently healthy. I have
Currently.
no cancer in my body. But that's not what my that's not what I'm asking. I'm asking, what more can I do?
Right. Right. And you would be very intentional to phrase it that way because I'm assuming they're just looking at, oh, blood pressure. Maybe like do like a blood, test, something like
Yeah, they
that.
do your basic metabolic panel, they do a basic CBC, and they're like, all your levels seem normal. So like, why
Yeah.
are you so worried? I'm like, what do you mean? Like that
Yeah.
it's not about, first of all, it's not only about normal. Like, am I optimal? I started listening to Peter Attia, I started listening to Mark Hyman, I started to understand like this world of biohacking and optimization. I was like, why isn't this part of the conversation with your primary care doctor?
Look, 1 in 10 Americans today struggle with alcohol use disorder, and I was one of them. Did you know that there is a safe, science backed daily pill that you can take to drink less or even quit alcohol for good? It's called naltrexone, a doctor prescribed medication that you get online, and our sponsor, Or Health, is the nation's leading provider of naltrexone. To date, Or Health has helped over 35,000 people find freedom from alcohol, and I'm proudly one of them. To get started, text STRENGTH to 710 710. Again, that's STRENGTH to 710 710 and get started on your journey to finally find freedom from alcohol. Yeah, amen. And you're sitting there, you're like, well, I was faced with my mortality at 23 years old, and I would like to not face it again. What do you got for me? Not just, send you out there real fast. So you said it came out of the blue when you got the diagnosis. Was there any like history in your family about nothing? It just
Nothing,
literally, wow, that must
nothing.
have been scary. I can't even
It
imagine.
was weird. I was like, is this really happening? I feel like you guys must have made a mistake.
Right.
It's like, are you
That's how I
sure? I
felt.
kept on like waiting for them to be like, oh, actually, I'm so sorry. This isn't this.
Right.
We made a complete mistake. This was someone else. But
Right.
yeah, no. And then once I started chemo, I was like, no, this is actually happening.
Wow. Wow.
Yeah, it was wild.
So where'd you go from there? So you had this awakening. You started, sounds like, learning about the other things out there.
Yeah. So at that point, I was like, I don't need a primary care doctor. Like, clearly, they're not going to be helpful to me. Let me go dive into wellness. Let me become the expert when it comes to wellness for cancer prevention. And so I read a ton of books. I listened to a lot of podcasts. I just basically was an absorber, a sponge of information. And again, going back to like being a perfect patient, I wanted to be the perfect cancer survivor. I don't know what it is about me. I guess it's like I'm just a very disciplined person, but I did all of the things. I was intermittent fasting. I cleaned my diet. I stopped drinking alcohol. Stopped consuming any sugar. I was like wellness obsessed. And about 3 years later, I lost my period. And I thought, oh, maybe this is an aftermath or a side effect of chemotherapy. So I went back to
Mm,
my oncologist. I was seeing him every year. And I said, do you think that this is just, the long-term buildup of chemo, or what do you think it is? And he's like, I don't know, because we don't really know what happens to women who have chemo at such a young age. So like there isn't enough data for me to definitively tell you that this is a side effect of chemotherapy. But he wasn't like, oh, your BMI is really low. Maybe we should up your weight. He didn't say anything like, oh, what are you eating?
mm,
How often are you exercising? There was no questions about like my lifestyle or what else could be causing it. I went to go see a gynecologist, and she was like, I don't know what the risks of chemotherapy are. I don't know enough about oncology to be able to tell you whether or not this is that or tamoxifen or just like anything else. No one was asking me about my lifestyle.
right.
And so at that point, I was like, all right, no one has answers. I'm just going to keep doing what I'm doing because it feels good. I feel like I am doing all the right things. Like, why would I question it?
Right.
Maybe I just like, maybe this is just chemotherapy and this is my life. Then I wanted to start a family, and ended up going and meeting with an IVF doctor. IVF doctor basically told me the same thing. We don't know why you don't have a period, but we'll give you hormone replacement and we'll get you, to produce those eggs. We'll do, the retrieval, and then we'll do the transfer and it'll be fine. I ended up doing 4 rounds of IVF, and the last 2 rounds actually stuck. I was able to get pregnant, but I miscarried. Both of them I miscarried. And I was like, this is weird. Why do I keep miscarrying? And he was like,
Right.
I don't know. I was like,
Mm,
really? Like, we're not going to figure that out before we try again? And he was like, maybe we should stop and consider surrogacy. And I was like, you know what? That's a good idea. if I don't know why I keep miscarrying, I'm not going to put myself through this again. I'm going to go through surrogacy and I'm going to figure this out on my own. So at that point, I was like, all right, we're moving forward with surrogacy. Both of my kids were with surrogates. Thank God for surrogates. That's a whole other story. But
Yeah.
anyway, I then met with a functional medicine doctor and I was like, clearly there's something wrong and I need to figure out what it is.
Mm.
So ran a bunch of tests and eventually figured out that I had hypothalamic amenorrhea.
Oh.
And for people who don't know what that is, it basically means that your body is in a state of complete stress, whether it's
Mm.
nutritional deficiency or over exercising or emotional, psychological stress. And I think it was a combination of all three of those things for me because I was probably eating under 1,500 calories. I don't know because I never counted my calories. I was just eating so
Right.
clean and the foods that I was eating were so, filling that I never felt like I was hungry. Like I was always eating my three big full meals. I was very much satisfied by my meal. So I never thought, oh, I'm under eating. Exercise wise, I was not a big cardio person. So I never felt like I was over exercising, but I was working out 5, 6 days a week. But like not anything super intense. So I didn't even question that. And then from a stress perspective, like mental health wise, I felt like I felt good. Like I had all this energy. I felt extremely motivated by what I was doing every day. Like I did not feel like I was emotionally stressed. But lo and
Mm.
behold, like my labs were saying something different. Anyway, so the takeaway from all of it was had I, at the point in which I decided to invest in my wellness, had done a baseline set of labs, not baseline in that like it was, the sort of small panel that a primary care doctor would do, like a really extensive panel across my hormones, my, you know, metabolic health, my cardiovascular health, my nutrient levels. Had I done a more baseline panel, I would have been able to then track all of these different interventions that I was self experimenting with to
Right.
see how they were impacting my health. But I didn't have any clinical oversight. I was doing this completely on my own. And I think that that's ultimately what led to my demise. And so when I think back to how could I have avoided this from happening, the answer really lies in having an integrated approach between medicine and wellness, having
Mm.
a no insurance model where my doctor could really spend time with me to figure out, okay, maybe I don't know enough about chemotherapy, but I'm going to take the time to figure it out. And I'm going to work with a nutritionist to figure out what should be the right diet for you. And we're going to also talk about exercise and we're also going to talk about supplements and we're going to track your labs every quarter to see how they're evolving so that we know that we're keeping your body in the right optimal state.
Mm.
If I had that integration, none of this would have happened.
Yeah.
And so that's the why. That's sort of what led to the Lanby is we need a care team model. We need a membership based platform that really sort of thinks about the all inclusive nature of primary care. It can't be a one off here and there, like, oh, let's schedule this visit. Now I need to pay you for this visit. Oh, but I need a separate visit to go through my labs. And oh, I need a separate prescription refill. And oh, I need a separate consult about, you know, whether or not I should be intermittent fasting. Like, but by the way, my doctor doesn't even know the answer to that question. So it's like we needed a home base.
Yeah. Yeah. As I'm listening to you, that for whatever reason, the word ecosystem popped into my mind, meaning like our health truly is an ecosystem and it all works together in the same way that nature is an ecosystem, right? If there's a change to air pressure, that changes precipitation, that changes the lake, that changes the ground, it changes like that. It all works together. And it feels like you, because of your persistence and your instinct that you could be doing more, were like running to separate siloed people and they weren't connected and they were just kind of focusing on their little area. And unless as a person, unless we have that instinct that I could do more, or the education, because it sounds like you started reading and listening to things, you would not have known to question what you were being told and to try to pull up and look at the forest instead of the trees. And how long between, I would say, like when you left your oncologist that first time, here's some medication, keep in touch, to finally having this awakening or realization that like, oh, I have clarity now. It's all interconnected. Like, how long was that journey?
Like 5 years.
5 years it took you to get there. That's incredible.
Yeah. And by the
And
way, like I still haven't figured it out. Like it's still an ongoing journey. And I think that's what's so challenging for patients today is like to your point, they have to be the quarterback of their own health. They have to, you know, connect the dots between all the different specialists that are telling them one thing versus another. And they use like one specialist as their primary care. Like, let's say you're someone who has a lot of GI issues. You end up saying, oh, but I've used my gastroenterologist for my primary care needs. But like, really, you're going to ask your gastroenterologist like what they recommend when you're dealing with, a consistent bout of colds and inflammation, or like they don't know anything about that. Or like
right,
you're going to talk to your gastroenterologist about your metabolic health and like the fact that you haven't been able to gain weight and you don't know, lose weight and you don't know why, or you need to gain weight and you don't know how. Like people are so confused as to how we
right.
should be interacting with the healthcare system.
Look, life can be hard and stressful sometimes. We all know that. But when it comes to supplements, why is it that nobody talks about stress and resilience? For me, I take the adaptogen stack from Momentous Supplements. It's a daily blend of ashwagandha, rhodiola, and L-theanine, all clinically backed to help you stay calm, focused, and resilient. I'm proudly partnered with Momentous Supplements because they are the industry's best. They don't cut corners. Everything's third party tested, used by pro athletes, and high quality. Head to livemomentous.com and use code STRENGTH for 35% off your first order. Again, that's livemomentous.com, code word STRENGTH for 35% off your first order, and get started today. Yeah, 100%. And I just want to clarify one term, right? Because I feel like it's a healthcare guy talking to a healthcare gal, but you say primary care, you've said it a couple of times. People, there's other like terms. I just want to clarify them here. You clarify them, but there's like family medicine doctor. Some people
Yeah.
say that primary care. Some people just say doctor's office, which is kind of like a catch-all. But what are the differences with those terms when you talk about primary care? And then I want to double click on your model and just go a little bit deeper behind the curtains of what it's like to step into a concierge model. But can you clarify those terms quickly?
Yeah. Okay. So there's primary care, there's internal medicine, there's family medicine, and there's functional medicine. I would say those, and then there's probably like the other people call it my GP, my general practitioner. That's
Got it.
another word that people use. So family medicine ultimately just means that you have a doctor who is board certified in family medicine. That means that they are able to treat patients at all ages, from newborns all the way to geriatric.
Mm-hmm.
Primary care is really the focus on like all of the sort of, it's like the first line of defense in terms of like, oh, you get sick, you have a cold, want to think about it should be like thinking about your health holistically. It's not, obviously. But it's like the first person that you go to when something's wrong, to like basically triage to figure out like, can that person fix the issue or do they need to send you to a specialist?
Mm-hmm.
When primary care is done right, 85% of healthcare needs can be addressed by primary care alone. You should not need to go see a specialist.
Mm-hmm.
The problem is that most primary care doctors will only spend about 8 minutes with you. And if they're not giving you an antibiotic prescription or some other prescription, they want to just hand you off to the specialist because they can't spend more time to figure out what's
Right.
wrong with you.
Right.
General practitioners are basically the same thing. They're either a family medicine doctor or an internal medicine doctor, but they're, again, general practitioner is like first line of defense, like they're your generalist. They're just different terminologies. And then internal medicine is another board certification, but usually those doctors work within the hospital system.
Mm.
They usually like are, working within a academic, or not even academic, but a hospital system. So it's like when you go to the doctor and you get seen by an internist, like that's usually, and then sometimes they do go private practice, but like their board certification is focused on being in a hospital setting. They're usually focused on adults.
Got it. Got it.
And then functional medicine is sort of this new model, relatively new, model of medicine where they look at the body, to your point, as an ecosystem.
Mhm.
It's an interconnected system where all of these bodily organs are interconnected and they depend on each other for different things. So they don't see your metabolic health as one siloed system. They don't see your hormones as one siloed system. They don't see your nutrients as being what it's your gut. Like all of these things are actually so interconnected, your brain and your gut, like your hormones and your cholesterol and all these things. And so when they look at your labs, they want a much broader set of labs because they like to see where these deficiencies are actually connected. And once they see that, they can help get to the root cause of what's actually going on in your body. A lot of times, when people are like, oh, I have like terrible acne and I have terrible fatigue and I have terrible, like, whatever it is, I'm bloated. It's like, okay, let's figure out what's actually happening in your gut. What's the inflammation that's taking place there? And maybe that could be the one root cause that's causing all of these other things to manifest. And sometimes when you think about, oh, I have acne, let me go to a dermatologist, they're just going to give you a prescription for acne. They're
Right.
not going to be thinking about it from the root cause. They're not looking at your gut.
Right.
And, same with like, oh, I gained a lot of weight and I don't know why. It's like people are just like, oh, maybe you should just put you on a GLP-1, or maybe we should just try to lose weight, or like try to
Right.
put you on a diet. Like, no, maybe that's actually not what it is. Like maybe your hormones are just completely out of whack. Maybe your
Right.
cortisol levels are too high.
Right. And
Maybe,
you know, you're making me think like most people choose their primary care doctor by like how close are they to me, right? There's a health system in the area. I'm going to go to them. You show up with a cold and they're like, yep, you got a cold. Here's some medication. Take it for 3 days. When they're not like, oh, yeah, you drink 30 drinks a week. You sleep like crap. You eat like trash. Your gut microbiome is trash. Like your immune system is weakened. And that's why you got the cold. Silly. Like, let's talk about all those things. They just go, what do you got? Here you go. Good luck. And they don't kind of look. So it sounds to me like we should all be looking for a functional medicine doctor. Would you agree?
yes. So the problem with functional medicine though is that a lot of doctors who've become certified in functional medicine now don't want to do primary care. And
How's
that was
that?
the problem that I encountered when I finally found functional medicine. I was like, wait, can't you also be my primary care doctor? Like, can't we also talk about my heart health and like prevention and all these things? But functional medicine doctors, that doesn't interest them. They don't want to do primary care anymore. They want to just focus on functional medicine. And so that didn't work for me because again, it felt like I was just creating another silo.
Mm,
So my vision was we need primary care. We need sort of a foothold within the healthcare system, but we need to broaden the definition of primary care by integrating functional medicine as a key modality as well as integrative medicine. So, integrative medicine is another modality that is incredibly useful when it comes to primary care. So, basically, what integrative medicine is sort of finding the bridge between Western and Eastern medicine. So Western medicine is like, typical medication, surgery, like all the things that we are used to. And then in Eastern medicine is when you think about like Chinese medicine, like acupuncture, herbs, also looking at like what you're eating and the sort of the impact that it has on like your gut and like warm foods, whatever. So a lot of times when you meet with an integrative medicine doctor and they're trying to figure out how to improve a certain issue that you might be having, whether it's your cholesterol or your metabolic health, they're not just going to recommend a prescription drug. They're going to say, let's try to alleviate this with lifestyle. And so
mm.
that's sort of where the treatment approach can also be a lot more whole body, whole person, looking at your day to day and sort of figuring out how to sort of naturally remove the inflammation as opposed to just like putting a stop to the symptom.
Yeah.
So, functional medicine and integrative medicine can work really nicely together. Oftentimes, you have practitioners who are only trained in one of the two. And so, we like to sort of pull from both of those modalities, but still be the same practice that you go to when you do get sick. And so, that's where also
Mm,
the member advocate piece really comes in because we want to coordinate your care as, in terms of like okay, yes, you come to us when you're sick, but let's say you come to us also when you just got diagnosed with prostate cancer.
Right.
Who do you go to? You don't want to have to figure all that out on your own. You need to figure out like, okay, which specialist do I need to go to? What's the next steps? Like who's going to sort of oversee this process for me? And so that's where the care coordination piece really comes into and advocacy. Like you can to the earlier point, like I had to know which questions to ask. And to a certain extent, like I was wary to even ask those questions because I wanted to be such a well-liked patient. But you really should be challenging your doctors. And oftentimes patients don't know what questions to ask. And so they just say, well, this doctor knows way more than me. Why am I going to question his authority? If he's telling me to do this treatment plan, I should probably just follow this treatment plan.
Right.
But we actually probably should be getting second opinions. We should be using our primary care doctors as our sounding board. And so that's
Right.
where we also can help.
And also, it sounds like where you're helping is I'm just kind of picturing myself being you, frankly. You were when you were running around these different specialists trying to get answers and guidance. It was probably very stressful. And it sounds like I'm assuming when you finally got some clarity, like your stress hormones, like cortisol and things, were probably through the roof, right? And you didn't even know it. You weren't experiencing it, but your body was stressed. My point is, it's like if I'm picturing myself working with this team, this integrated team that has primary care that can treat more like acute things. Like I'm sick, I can go to you. I want to prevent getting sick, I can go to you. I get a diagnosis, you can guide me through it. My point is, I would have so much more peace of mind knowing, to put it simply, that like someone's got my back. Someone's like looking
Exactly.
out for me. I don't have to be quarterbacking my own care. I can go to this trusted team that's looking at that ecosystem and helping me connect the dots. Like this is what you're reporting to feel and experience. This is what your tests show. This is what your background shows. Have you thought about this? Because in the current state, if you're just relying on the status quo, you very much are probably leaving these specialists and these doctors with this like weight at night. Like, is there something else? And it feels like to have someone that has your back like that would just, if anything, give some peace of mind, which would lower your stress and improve your mental health and allow you to focus on your physical health, which is probably what got you to engage with the health system in the first place, if that makes sense.
Totally. Totally. One of the things that I love is when our members say that we almost cured them of being a hypochondriac,
Yeah, there you
right?
go.
Like I'm like, that's amazing. That's like the best thing that we could have done is like give you the peace of mind that you don't have to be worried about your own health because we're thinking about it. We're making sure that we're, checking everything so that you don't have to feel like something's going to slip through the cracks.
Yeah, I love that. Your website, I want to talk about like the journey itself because sometimes people can understand how it would work because this is a pivot, it's a change if you would work with like the Lanby versus what you're used to. But sometimes it helps to kind of like pull back the curtains and describe like an experience. Your website, and I'll point everyone to it, thelanby.com. I'll link to it in the episode description. But your website does a great job, very simply breaking down what I'll call kind of like the onboarding process and
Yeah.
then into the actual care process. But if a person, patient, right? But if a person says like, "Hey, I want to explore this," like what is that actual experience like? And then once they're actually working with your team or teams, like what can they expect? What does that feel like?
Yeah. Great question. So we basically modeled it as, from the patient perspective, like what would be the ideal patient experience. We like to call our patients members. So it really does feel as you're going through this that you are a member of a practice where like you feel like there's stuff happening even behind the scenes, right? So like we're really trying to change the dynamic of like fee for service to ongoing membership. So when you join the Lanby, the first step is an onboarding call with your member advocate. So that person is assigned to you as your liaison, your chief of staff, your admin when it comes to all things at the Lanby and externally interacting with the broader health and wellness system. So they'll give you the lay of the land of what to expect, but then they will also help you schedule your onboarding call. Your baseline visit. They'll tell you what to expect throughout the course of your membership. And they'll also sort of use that time to just get to know you personally. Like, what are your motivations? What are your fears? What are the things that frustrate you? How do we make sure that we create the best experience for you possible?
Hmm.
About a week later, depending on when they scheduled their baseline visit, they come in person for their baseline, which is an 80-minute visit. So during that time, They first meet with their care team, which is their
80 minutes.
physician, 80
80
minutes.
minutes
So
is a that's
a
a
long
long
time.
time. That's
Yeah.
great. That's a
Yeah.
typical doctor's appointment these days is 20 minutes, of which you see your actual doctor for 7, and a medical assistant is with you asking questions. But go ahead. I'm just blown away by 80 minutes, but keep
Yeah.
going.
So the first like 40 minutes are a conversation between you, your doctor, and your wellness advisor. So we actually have created this choreography where we have physicians and wellness advisors working together as a team. The reason for that is because, again, as a patient, it's super annoying when you go to meet with your doctor, you tell them your whole history, and they're like, okay, great. I think what you need to do is probably improve your diet. Go talk to the nutritionist about improving your diet. Then you have to schedule a separate conversation with that nutritionist
Oh,
about 2 weeks
yeah,
later,
four
and you
weeks
have to
later.
repeat everything
Yeah.
that you just said to that doctor. It's super inefficient
Yeah.
and frustrating, right? Like, why
Hmm.
don't you already have all of this information? Why do I now need to regurgitate? And by the way, schedule two different appointments for this.
Right.
So we wanted it to be a joint visit. So 40 minutes, go through your medical history, your family history, your lifestyle. What are the things that you're doing from the moment you wake up to the time that you go to sleep? What does it, a day in the life of Jesse look like?
Mm.
Then we will do a physical exam where you're doing that with the doctor. They have a moment to be one on one with you, talk about things that are maybe more intimate. You don't want to necessarily talk about in, a 2-on-1 dynamic. We'll also do body composition analysis. So that's the measure of your visceral fat relative to your muscle mass, which is a really helpful longevity marker. And then finally, we'll do vitals and very extensive labs. So we draw.
Virtual,
This is
virtual or
all
in
in
person?
person. No,
It's
this
all in
is all
person.
still in
Got it.
person. This is all
Okay.
still part of the 80-minute visit. So after that 80-minute visit, you leave, you schedule your baseline follow-up visit, which is a virtual visit, and that's to go through your care plan and your lab results. So during those, about 2 weeks, we've collected all of your previous records from other specialists. We've reviewed your lab results. We've also, taken into account your lifestyle and all of these sort of factors that you shared with us, your family history, and that informs how we want to focus your care over the next 3 to 4 months. So we break it down into a quarterly care plan. The reason for that is because if we were to give someone an annual plan, that would be way too overwhelming.
Hmm.
And you can actually see progress after 3 months in your
Yeah.
labs. And
How
so
do
we
you
want
share?
to,
How do you share the plan? What does that look like if I were to receive it?
so you receive it as a PDF
Hmm.
via email. We then go through it with you in your virtual visit where we screen share with you. We screen share also your lab results. We go through every single lab result in detail, even the ones that are considered optimal. We want you to understand what that means. What are you doing right? What do we want you to continue doing? And then what do we want to tweak so that you can, obviously improve any of the levels that are deficient, suboptimal, wherever they stand. We'll also sort of give you an explanation as to like what our hunches are as to like why you might be feeling how you're feeling. Sometimes though we need to investigate further, and that's when we can either do a deeper dive on labs or layer in advanced diagnostics. That will all be included in your care plan. So in your plan, you'll also see recommendations for nutrition, for exercise, for supplements, for specialist referrals that we coordinate for you, for preventive screenings or imaging, and for any medications that you might need.
Mm.
So that care plan is like, okay, this is what I need to do in the next 3 to 4 months. We try to be as clear and prescriptive as possible. Then 3 to 4 months later, you come back in for repeat labs. Um, the goal there is to see like, okay, what's the progress?
Did we
Like,
move the needle?
did we move the needle? Did we not? Did we go too far? Like maybe this wasn't, agreeing with your body. And so that allows us to then reflect on the care plan and say, do we need to adjust this care plan? Do we now want to focus on something different because you've actually achieved progress and now we can put you in maintenance mode on this? Or, do we need to pivot and try something different and, work on that same goal? So it really depends on the individual. Sometimes that's also just a good check-in moment for people who have, ignored their health, and they use that as a moment to say like, you know what, my sleep actually hasn't been that great recently. And I think it's probably because of this, but like, what do you think? And so it's just a nice sounding board, check in, a time to reflect on your health and keep yourself accountable. So we meet with our members every quarter, and they're always joint visits between the member, a clinical member, and a wellness member on your team. So it's
Wow.
very efficient in that way. And then you always have the ability to schedule one-on-ones with your wellness advisor or your physician or an advanced practitioner
I
to
see.
be able to have those more intimate conversations if it does feel like a specific, topic you want to go through. And then we have an app that allows you to chat with your care team. So chat ends up being really useful for some of the small questions that come up, especially now with wellness being so overwhelming and confusing and people being targeted right and left on social media with different ads. People use the chat for questions like, "Oh, I just got targeted this supplement on Instagram. Can you tell me what you think of it? Like, do you think that this could be a good fit for, my,
That's
this
unbelievable.
goal that I have? Or like, I, want to change my meal plan. Like, what do you think that I should, incorporate that I have for seasonal vegetables? Or, maybe it's more of a clinical question like, I just got diagnosed with COVID. Um, what are some of the natural remedies that I can be using at home to like accelerate my recovery? Because, there's
Yeah.
not really much you can take when you get COVID. You just have to wait it out. But there are ways to accelerate your recovery. So chat ends up being a great, efficient way to stay in touch with your care team, not necessarily have to book a visit, and just triage a lot of the questions that pop up in your head.
That's amazing. I just bought a cold plunge. I have to build it this weekend, but like I don't know how to use the thing. I just know it's supposed to be good for me. Like I can see myself instead of going to Chat GPT, just like chatting you guys and be like, "Hey, like I got this. Is this even going to be good for me and how should I use it?" I can see myself using that like every day. Honestly, I don't know how you how you provide that access
No,
because you
people
can
do.
get
No,
questions
people
left
do.
and right.
It's great. I think it's great. I think it's great. I think that it's a great way to stay engaged with your members and just like keep them on this steady like progress train.
Yeah, that's amazing. I know off of your website it says subscription, and you used that word before. Can you describe how that works, the subscription model for your healthcare?
Yeah, so it's basically one flat fee that you pay annually. And the reason that we did it that way is because we wanted it to be incredibly transparent. We wanted
Yeah.
one moment in time where you have to think about cost, but then after that, you never have to think about it again. The reason for that is because there's this like awkward there's this awkward like sensitivity that people have when they interact with their primary care doctor or any doctor where any question that you have you feel like you're going to get upcharged and then you're going to get a surprise bill in the mail and it's like
Yeah.
really they charged me for that 5-minute phone call
Hmm.
or really I just had one like I just needed that one prescription refill and they charged me for that or I needed that one flu shot and they charged me for that or like I just you know what I mean like
Yes.
I never wanted
Skepticism.
people to feel like they were going to be upcharged right and left and like that was going to sort of detract from the experience. So it's an all-inclusive model. You never have to think about cost again. And then it's subscription. Like if you ever want to cancel after a year, you can. Like you're not sort of tied to this. But I think the benefit from an incentive perspective is that we're realigning that the goals for the physician and the patient, right? Like in the traditional fee for service model, physicians are incentivized to increase the number of visits that they have with patients, whether it's a single patient or multiple patients in a day. Their goal is to see as many patients as they possibly can because that's how they make more money.
Right.
For us, we didn't want that. We wanted them to be focused on retention. How do you retain members? It's by keeping them happy, making them feel supported, making them feel heard, making them feel like this is a worthy investment. And so this allows us to like refocus where we want providers to invest their energy into making members happy and making members feel like the customer as opposed to the insurance plan.
Yeah, and I love that you do it that way because if let's just say you offered like a monthly subscription, that's counterintuitive to what you're trying to accomplish. Going back to what you just described, these quarterly check-ins and moving the needle, to say that again, you can't move the needle month over month. And if someone just comes and sees you and goes through the process and gets their PDF and they make those changes, what happens next if you're just not a member anymore after 2 or 3 months? Like you're there for their long-term health. It would make no sense to have a short-term type model, my chance, because it takes time to improve your health.
I totally agree. And this is like a big shtick that I have with like executive physicals because I think that they make create this perception that like in 2 days you will be able to have every answer that you need in order to feel in control of your health. And that is just not true. They
Oh,
basically bundle in all of these different diagnostics, all the same diagnostics for every single person, which, by the way, not every person needs the same screenings or the same
right.
diagnostics, right? Like you should be tailoring them to the patient's family history, the patient's medical history, their lifestyle, their age. But anyway, they sort of create this illusion that like you're going to get every test under the sun. And by having all that data at your disposal, you are empowered. By
Yeah.
definition, you are basically putting all this information into the hands of patients that they then don't know what to do with. And then often they need a lot of help coordinating their care over the next year, and they don't have any of that support. So people are paying $10 to $25,000 on just 2 days of an executive physical when they really should be investing in a year's long worth of membership, which is the same price, but they're going to be a lot more strategic about when they incorporate those screenings, and they're going to leverage your insurance to be able to cover the cost of some of those screenings so that you're not paying out of pocket for everything. And
Right.
that's where our model, we really focus on, we're going to be the primary care guide, and we're going to deliver as much care as we can in-house. But obviously, when it comes to screenings, when it comes to labs, when it comes to diagnostics, we're going to try to, and specialists, we're going to try to use your insurance as much as we can, because those are the things that you should be using insurance for.
Yeah, 100%. And also, like having long-term access to a team
Yeah.
like yours, it also there's accountability, right? Like if you give me, right, I'm the type of personality where if you give me something to do, I'm going to do it. And if I don't do it, I feel honestly ashamed, and that's why I do it. But like if I know that I've got that meeting coming up in 3 months, I'm not going to show up and you're going to ask me like, okay, so we talked about all these habits that you were going to change. How are you doing? I don't want to be like, oh, I do any of it. So it's like I think the accountability long term is important for sustained habit change and lifestyle change and all those things. So
Yeah.
I love it. I think it's amazing. I want to ask you, Chloe, one more question about the future. So we talked a lot about kind of the current healthcare system and where it should go. I'll put it that way, and how the Lanby can help. But when you kind of look forward into a broader vision, where do you see the Lanby going? Where do you think, as a society, healthcare should go? And then maybe mention just anything that, if you could share, anything that you might be working on that maybe you're not doing now that we should be excited about.
Great question. So obviously, my vision is that more practices embody this more proactive approach to primary care. That is the future. I think we need to not necessarily be investing in more consumer diagnostics that put more data into the hands of consumers, but rather investing in primary care that is more comprehensive, more cutting edge, really helping people navigate all of the data that is at their disposal in a thoughtful, personalized way. That is what I believe the role of primary care should be. And I think that that is where we are headed. And I think that we are the ones that are sort of pushing forward that message more than anyone else. And I'm very proud of that because it's very saturated market right now in terms of health and wellness. And I think, again, like there's so much power that we can give to the consumer, including access to things like ChatGPT, but at the same time, recognizing the role of the provider and how we can stay relevant is where we ultimately end up saving as consumers and also saving our healthcare system.
Mm.
In terms of where I, hope to take the Lanby, obviously, right now we're focused on New York and the tri-state area. We do have some members in Florida and California just because we're licensed there. But my goal is to be able to open a few more locations across the country, but still be very methodical in how we grow. I want to make sure that the quality of our care, the consistency of our care is at the highest standard before we start to invest in more locations. Oftentimes that like super fast growth is at the risk of diluting that quality. And that's not
Yeah.
something that I'm willing to compromise on, just because, again, I think from the patient perspective, you lose everything when you start to grow too quickly and focus on growth over quality of care. Um, and then what we're working on. So, we were talking earlier about parenthood and what
Mm,
it means to be a good parent today. And I now have two young kids, 3 and 2-year-old, and I find myself asking questions all the time about like, how do I raise these kids to, um, you know, have the same values about health and wellness that I now have, right?
mm,
Like we're up against the school system, we're up against the healthcare system, where, we now are at the whim of what they impose, whether it's vaccines, whether it's antibiotics and Tylenol, and whether it's like, a certain milestone cadence or whatever it might be. Like I feel like I am very torn between like what I want for my kids and what I feel like I have to do because things are mandated of me. And I feel like there's no safe space to be able to talk about that freely. And I don't necessarily have the answer, but I think what I've realized is lacking for parents today is that safe space to have those conversations with their trusted providers. And I think on the other side of the spectrum, like if you look outside of healthcare and you focus on wellness, I think the wellness industry, when it's focused on kids, is also becoming very, very daunting to navigate as a parent. There are so many quote unquote experts out there telling you how
mm.
to raise good children, how to be, include gentle parenting, how to think about independent play, how to give your kid the right nutrition, how to help them, develop better sleep, like all of these things. And it's like you just feel overwhelmed. Like, am I
Yes.
doing everything right? This literally feels like this is another part-time job. And that was the whole reason why I did, what I did to begin with when it comes to the model of the Lanby. And so I think as I think to the future, and I don't think it's too far off, I'm really excited about expanding the scope of our services to include the entire family,
Yeah.
because I want moms and dads to be able to feel like they have a sounding board in their family medicine doctor to talk about their kids' health. And I want to be able to also support that kid's health and, you know, figure out the right cadence of care that's really going to acknowledge all of the, crazy things that are happening with kids today, the anxiety, the, you know,
Technology.
stress, the technology exposure, the changing of like what was in our food. I mean, it's everything. It's everything. And I think that our model is so well equipped to be able to support that. So that's sort of where right now my heart and soul is going with this the company is like figuring out what the model of pediatrics looks like, and hopefully we're launching that in early late 2025, early 2026.
Now, let me know. Sign me up. I think it's beautiful that as a leader, like as you're stepping into and experiencing parenthood for the first time, now you're inspired to bring pediatric care and bring that into your company. Look, it's ironic time, but it just so happens my son JJ is 2.5. He just had his, I get whatever you call it, like his regular visit with our pediatric provider, and I wasn't able to go. And my wife came home, and I said, "How did it go? Like, how did his appointment go?" And she goes, "He's 98% in height." And I'm like, anything else? Like, what else? Was there any other conversation? Was there any other? And she goes, no, he's good and he's tall. It's like, that's all we got. I was like, it's case in point. Like, what if the questions were more like, well, like talk to us a little bit about like his behavior, talk a little bit about his screen time, talk a little bit about his diet. Like, how can we make sure that like we're guiding him, to be a healthy human that's balanced and has emotional and physical health. So I think it's lacking. I think it's overwhelming as a parent if you try to find information because it's fragmented, and oftentimes it's just like diametrically opposed, the guidance that you get, and you kind of walk away from it and be like, well, I'm just going to figure it out, I guess, So I think it's needed. I think it's excited. I'll say this. I loved talking to you. I feel like there's a couple topics we can probably go deep on and have another hour episode. I'm going to put you on the spot and invite you. If you could come back, I think we should check in maybe like every couple months and just have different
I'd
topics
love to.
because, yeah, the wisdom that you shared and what you're doing, I think is exactly what people need. And it was an honor to host you on the show today. So thanks for joining.
Thank you. So sweet. Yeah, I would love to come back. Yeah, love talking to you too. This is so fun.
Awesome. Chloe Harrouche, everybody. All right, everybody. That's the show, folks. Thank you so much for tuning in to this podcast and spending some time with us today. We've got a favor to ask. If you enjoyed the show,
would you please consider subscribing to the show and even leaving a rating and review? That simple act drastically helps us reach more people in our mission to help them live better, longer, healthier lives. You can also follow us if you'd like on Instagram and YouTube for regular tips and motivation around mental health, addiction, and so much more. Know that your support fuels our brand and is greatly appreciated. So until next time, stay strong and live deep.